What if I told you that the most dangerous moment of any fall is not the fall itself, but the 10 seconds right after? In those 10 seconds, your body makes 4 separate decisions, and 3 of them can hurt you worse than hitting the floor ever did. Your heart rate spikes. Your blood pressure crashes the moment you try to sit up. Your brain releases its own painkillers and quietly hides serious injuries from you for 30 to 90 seconds. And somewhere around the 7th second, the part of your mind that solves problems shuts down at the exact moment you need it most. I have spent years watching this happen to my patients, and almost none of them know it is coming. Today, I'm going to walk you through what is happening inside your body in those 10 seconds. And the single exercise, done lying down on your own bed, that changes the entire outcome. If your legs feel weaker than they used to, this may be the most important video you watch all month. Before we dive in, if you haven't subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. If not, type 0 to let me know how I can make better content for you. 1. Seconds 1 to 3. The adrenaline lie. The most dangerous lie you will ever hear comes from inside your own body. It happens about 2 seconds after you hit the floor, and it sounds like this: I think I'm okay. Most of my patients over 60 have heard it, and I want you to understand exactly what is happening when you do. Because that voice is not the truth. It is your nervous system doing what it was designed to do tens of thousands of years ago, and in those first 1 to 3 seconds, it is actively working against you. Here is what is happening chemically. The instant you go down, your body floods your bloodstream with adrenaline and cortisol. At the same time, it releases its own natural painkillers, endogenous opioids, chemically very close to morphine. And these can mute up to half of the pain you should be feeling. Your heart rate jumps 30 to 40 beats per minute. Your pupils widen. Blood rushes out of your skin and your stomach and into your large muscles. Because biologically, your body cannot tell the difference between falling on your kitchen floor and being charged by a predator 3,000 years ago on the savannah. Now, here is why this matters for you. If you have fractured a hip, a wrist, or a rib in the fall, you may genuinely not feel it for the first 30 to 90 seconds. I have personally seen patients in their 70s push themselves up off a bathroom floor, walk to the bedroom, sit down on the edge of the bed, and only then realize they cannot move their leg, because by that point the adrenaline had worn off and the broken hip finally announced itself. They did not make a foolish choice. Their chemistry betrayed them. So here's what I want you to commit to memory tonight before you ever need it. If you go down, do not get up. Lie still. Count slowly to 30. Breathe in through your nose, out through your mouth. Let the adrenaline recede. Only after those 30 seconds, when the real pain, if there is any, has had time to surface, do you begin to assess yourself. That single pause has protected more hips, more wrists, and more independence than I can count in my career. It costs you nothing. But surviving those first 3 seconds is only the beginning, because in the very next instant, your blood pressure is about to do something that puts you at far greater risk of a second fall, and the second fall is almost always worse than the first. If you're still watching and finding these insights helpful, please comment number 1 below to let me know you're with me. Now let's move on to point number 2. 2. Seconds 4 to 6. The blood pressure trap. There is a reason emergency rooms see more serious injuries from second falls than from first ones, and it almost always happens in the 4 to 6 seconds right after someone tries to sit up. We call it orthostatic hypotension. You may have felt it your whole life without knowing what it was. It's the moment you stand from a chair too quickly and the room briefly tilts sideways, or you swing your legs out of bed and have to grab the headboard. In a healthy 30-year-old, that dizziness lasts a heartbeat. In a 75-year-old who just fell, especially one taking blood pressure medication, it can last long enough to put you back on the floor. And this time, your hands aren't out to break the fall. Here is the physiology in plain English. When you've been horizontal, gravity stops helping pump blood back to your heart, and your blood pressure naturally settles lower. The moment you try to lift your head or push up to sit, your heart suddenly has to fight gravity to get oxygen up to your brain. In a younger body, the autonomic nervous system catches that change in milliseconds. In an older body, especially one on lisinopril, metoprolol, amlodipine, or any of the common diuretics most of you are familiar with, that response is delayed by 2 to 4 full seconds. During those seconds, your brain is genuinely undersupplied. You feel lightheaded. You feel weak. If you push through it, you go down again. And the second fall does the damage the first one did not. So here is exactly what I want you to do. Before you lift your head, before you try to roll, before you do anything else, pump your ankles. Flex your toes up toward your shins, then point them down 10 times. This is not exercise, this is mechanics. Your calf muscles are your body's second heart, and squeezing them physically pushes blood back up toward your chest before you ever try to sit. Then move in 3 deliberate stages, from your back to side-lying, side-lying to sitting, sitting to standing. Pause 10 full seconds at each stage. If the room moves, you go back 1 stage and wait. Surviving those first 6 seconds protects your body. But what happens between seconds 7 and 10 is where your mind takes over, and most seniors lose that battle before they even know it has started. 3. Seconds 7 to 10, the panic window. I just froze. That is the phrase I hear most often from patients describing the seconds after they fell. Not I was hurt, not I was confused, just frozen, and every time I hear it, I want them to know what I am about to tell you. That freeze was not weakness, not failure, and not something to be ashamed of. It was your brain doing exactly what it was wired to do under sudden physical threat, and somewhere between the 7th and 10th second on the floor, it happens to almost every senior who falls. Here is what is happening upstairs. Under acute stress, blood flow to your prefrontal cortex, the part of your brain that solves problems, makes decisions, and keeps you calm, is temporarily reduced. The deeper, older parts of your brain take over. Those parts are excellent at making you fight or run, but they are terrible at step-by-step planning. At the same time, the muscles around the area of impact splint reflexively, locking up to protect what might be injured. That protection feels from the inside like paralysis. Your breathing goes shallow without you noticing. Less oxygen reaches your brain, and the harder you try to think your way out, the worse the loop gets. Now here is the part I want every one of you to remember because it works in seconds and it costs nothing. The fastest way out of that loop is your breath. Take 1 slow breath in through your nose, then exhale through your mouth for a full count of 6. Long exhales activate the vagus nerve, which is the brake pedal of your nervous system, and they physically lower your panic response within 2 breaths. Then do what we call a body scan. Wiggle your toes, flex your ankles, move your fingers. Slowly lift each arm. Gently turn your head side to side. You are checking for damage, and you are also telling your nervous system, I am still here. I can move. I am okay. And finally, and this sounds strange until you try it, speak out loud. Say, I am safe. I am thinking. I am moving. Hearing your own calm voice resets your brain faster than thinking the same words silently. It is one of the oldest tricks in trauma medicine, and it works at any age. Once you've calmed your body and confirmed you can move, the question becomes a different one entirely. Why your legs won't lift you off that floor even when you're ready. And the answer is going to surprise most of you because it isn't your legs at all. Important warning. Let me pause here because what I'm about to say matters more than anything else in this video. Everything I have just taught you and everything I am about to teach you only applies if you have already confirmed you are not seriously injured. If after a fall you feel sharp, severe pain in your hip, your back, your neck, or your head, stop. Do not roll, do not pump your ankles, do not try to sit up. Stay exactly where you are and call 911 or press the button on your medical alert pendant if you have one. The same goes for sudden vision changes, ringing in your ears, confusion about where you are, or any inability to move a limb. Most falls do not break anything, but the ones that do require you to stay completely still and waiting for help is never weakness. It is the smartest thing you can do. If you're still watching and finding these insights valuable, please comment number 1 below to let me know you're here. Now let's keep going with point number 4. 4. The hidden reason your legs won't lift you. Try something for me right now while you're watching this. Squeeze the muscles in your bottom, your glutes, as hard as you can like you're holding a pencil between them. Hold for 5 seconds. Now relax. If you couldn't really feel them squeeze, or if it took conscious effort just to find them, you've just discovered the single biggest reason most seniors can't get up off the floor, and it has nothing to do with your legs. Here is the truth that very few people will tell you out loud. Lifting yourself off the floor is not a knee movement. It is not a thigh movement. It is a hip extension, the action of straightening your hips from a bent position to a tall one, and the engine for that movement is the gluteus maximus, the largest muscle in your entire body. We have a name for what happens to that muscle in the average American senior. We call it dormant butt syndrome, or more clinically, gluteal amnesia. It is a documented condition, and it is caused by exactly one thing: the number of hours you sit each day. Every hour you spend in a chair, your hip flexors at the front of your hips quietly shorten and tighten, and through a reflex called reciprocal inhibition, they send a signal to your glutes to stay quiet, stay relaxed, stay out of the way. Do that for 40 years and your largest, most powerful muscle slowly forgets how to fire when you need it. Your quadriceps try to compensate, but they are working at the wrong angle to push you up from a deep floor position. That is the moment when people tell me, "My legs just gave out, doctor." Your legs didn't give out. Your glutes were never invited to the meeting. Here is the good news, and I want you to hear this clearly. The glutes wake up faster than almost any other major muscle group in the body. For most people I work with, they begin firing properly within 2 weeks of the right activation work, and you can feel real strength return within 4 to 6 weeks. You don't need a gym, you don't need to stand, and you don't need to be young. Which brings me to the single most important exercise on this entire video. The one you can do tonight, on your bed, in less than 2 minutes. 5. The one exercise, the glute bridge. Lie flat on your back. Bend your knees so your feet are flat on the floor or on your bed, about hip width apart. Let your arms rest at your sides, palms down. That is starting position. What happens in the next 90 seconds is the most important conversation your nervous system will have all day, and it is called the glute bridge. Now, before you move, squeeze your buttocks hard, the same squeeze we tested a moment ago. Holding that squeeze, lift your hips slowly toward the ceiling until your body forms a gentle straight line from your knees to your shoulders. The lift comes from the squeeze, not from pushing through your lower back. If you arch your back to get higher, you've lost the exercise. Hold at the top for 3 full seconds, long enough to say 1 Mississippi, 2 Mississippi, 3 Mississippi, and then lower yourself slowly over 3 more seconds. Slow on the way down is where the muscle actually gets stronger. That is 1 repetition. Start with 8 repetitions once a day before you go to sleep. That is your entire prescription for the first 2 weeks. When 8 feels easy, move up to 12. Around week 5, do 12 in the morning and 12 at night. By week 8, you can begin the single leg version. Same movement, but with one leg extended straight while the other does the work. That progression, followed honestly, will give you back the muscle that decides whether you can stand up from your own living room floor. 2 important checks every time you practice. First, you should feel a clear squeeze in the meat of your buttocks, not in your lower back. If your back is doing the lifting, lower a few inches, re-squeeze the glutes, and try again from there. Second, your knees should not flare out to the sides or collapse inward. Keep them tracking right over your feet. Place a small pillow between your knees if you need a physical reminder. 8 repetitions. 2 minutes on your bed before you turn out the light. That is the smallest investment you will ever make for your own independence, and one of the largest returns you will ever see from a single exercise. But knowing the exercise is only half the work. The other half is rehearsing the entire 10-second sequence, the breath, the body scan, the ankle pumps, and the bridge, so that on the day you actually fall, your body already knows exactly what to do before your mind has time to be afraid. 6. Rehearsing the 10 seconds before you need them. Here is something most doctors will never tell you. Knowledge alone will not save you on the day you fall. Not this video, not any pamphlet from your last checkup. Knowledge lives in the thinking part of your brain. And as we talked about earlier, the thinking part is exactly the part that shuts down when your body hits the floor. The only thing that survives a panic moment is what your body has already practiced. There is a name for this. We call it procedural memory. It is the same system that lets you brush your teeth half asleep, drive a familiar route while thinking about something else, or pour a cup of coffee without watching your hand. Procedural memory does not require thought. It runs on its own. And it is the only kind of memory you can fully trust on the worst day of your year, which is why I want you to rehearse the 10 seconds you hope you never need. Once a week, pick a consistent day. Sunday morning works well for most of my patients. Set aside 5 minutes to practice the whole sequence on your bed or on a soft rug. Lie down on your back as if you have just fallen. Stay still and count slowly to 30, breathing through your nose. Then do 10 ankle pumps. Then run a slow body scan from your toes to the top of your head. Then transition in 3 deliberate stages. Back to side lying to sitting, sitting to standing, pausing 10 full seconds at each stage. Finish the rehearsal that same night with 8 glute bridges before you turn out the light. 2 practical notes. If you live alone, tell a son, a daughter, a neighbor, or a friend at church that this is your weekly drill, and pick a time when somebody could check on you if needed. And if you wake up at night to use the bathroom, which is when more falls happen than any other moment of the day, take 10 extra seconds to sit on the edge of the bed and pump your ankles before you stand. That single habit prevents more falls than any exercise I can teach you. Practice does something fear cannot undo. It replaces uncertainty with competence. And competence on the floor is the quiet foundation of independence in every other room of your house. Final takeaway. Nobody warned you about those 10 seconds. Doctors don't talk about them. Your family doesn't either. The pamphlets at your last checkup didn't mention them, and the safety brochure on your refrigerator doesn't either. But those 10 seconds are where independence is won or lost, quietly, alone on a kitchen floor or a bathroom tile, in a moment nobody else will ever see. Here is what I want you to take with you when you close this video. You cannot control whether you fall. With age, with medications, with a wet floor and a single moment of distraction, anyone can fall. What you can control, completely, starting today, is what your body already knows how to do when it happens. The breath that pulls you out of panic, the ankle pumps that wake your blood pressure back up, the body scan that tells you what is hurt and what is fine. The slow 3-stage transition. The squeeze of a glute that lifts a hip, that lifts a body, that puts you back on your feet, in your own home, on your own terms. That is not a small thing. That is the difference between a story your family tells over Thanksgiving with relief and a story they tell with sorrow. It is the difference between a phone call to your daughter that begins, "I had a little fall, but I'm okay," and a phone call she will never forget. So tonight, before you turn out the light, do this for me. Lie flat on your mattress, bend your knees so your feet are flat on the bed, and lift your hips 8 times. Don't worry about doing it perfectly the first time. The squeeze is what counts. The form will follow. That is it. 8 repetitions, 2 minutes. You will have just trained the single muscle that decides whether you stay on the floor or stand back up. If this helped you today, do 3 things for me before you go. First, leave the word bridge in the comments below so I know you are going to try it tonight. I read those comments, and they tell me who is taking this seriously. Second, send this video to one person over 60 who needs to see it. A parent, a spouse, a neighbor across the hall, a friend you sit next to at church. You may save them from a fall they don't yet know is coming. And third, subscribe to this channel, because next week I am breaking down the 4 warning signs that show up in your legs a full 6 months before a serious fall. And most seniors miss every single one of them. I will see you there.